What's happening in Canada then, in terms of, are there any cases? What about the 5 in Quebec or 6? Could you bring us up to date?
So first message is to Canadians is the risk still remains very low for Canadians in terms of acquiring this particular illness in Canada. The fact that there are some cases that are under further examination is actually a good sign. It's a sign that our system is working and that the public health and medical professionals across the country are working together and are following protocol. Dr. Tam, who you know is our Chief Public Health Officer, is working very closely, daily in fact, with all of the leads across the provinces and territories. That's also very good. And she's also working very closely with the World Health Organization and other international partners, and they are having daily meetings as well. So I feel assured that the processes that we've put into place, that we've learned since the experience of SARS some years ago, are actually functioning just as they should. So there are already a number of screening tools at airports, and so as we work with our international partners and we determine more about the virus and the level of contagion, there may be more measures that we need to take. But at this point, as I said, we're confident that we have a system that's actually taking a closer look at anyone who meets certain criteria around potentially being infected. At this point, there has not been a positive case in Canada.
What are the measures that are being used at airports?
So there are measures around self-reporting, for example, if you're appearing at the airport from the region or really from anywhere. International travelers are being asked to identify if they have flu-like symptoms, fever-like symptoms. There's additional questions on the kiosks as well that really target into the sort of regional area of Wuhan. And so this allows for a closer examination. But the real protection is actually with our public health system. And so, when people are presenting with symptoms that meet those criteria, but also that have experienced international travel, it may indicate to the public health professionals, given the circumstance of the case, that they need to take a closer look, and that's exactly
Can
what's
you tell us
happening.
any updates on the
State,
number
are
of
there more
patients that are under observation right now in Canada?
I believe it's 6, it's 5 or 6, I believe. One person has been cleared of having the virus, but they are monitoring the others.
Where are they
What
based?
There was a case in Vancouver, I believe, and also Quebec.
Ms.
Any
Hajdu,
other-
should people think twice about going to China?
At this time, we're not recommending that people cease travel internationally. Again, it's a very specific virus, and the risk is low to Canadians. Having said that, we do have cautions on our web pages around travel to China, to the region of Wuhan, and more specifically, actually. And the cautions are really what to watch for when you return. So to monitor yourself and your own health if you return.